So I use a trabecular metal press fit total knee, and the reasons why is I think we're using these knees in younger and younger patients. And because of that, we are worried about the lifespan of these implants in patients. And when we use cement, we know that will fail at some point in the history. And what we're hoping is with the trabecular metal and the press fit technology that we have currently used, that these knees may last longer. They may last much longer than we've ever had before. We may also be able to decrease our revision rates in total knee replacements. Also, let's say maybe they don't last as long. Revising a press fit total knee really does preserve the bone stock so that if a revision has to be done later, there's so much more real estate to work with. Essentially, you don't have that bone that's been destroyed or compromised by digging out or cement itself. And these are the main reasons I use press fit total knee replacements. I've started using cementless total knees probably around year 2011, so going on almost a decade. My indications have probably expanded. I tend to use this on almost everybody. There are some that I do not want to use it on, and that includes our rheumatoid patients that might be on some disease-modifying medications that might interfere with the osteointegration into these components. I may also choose to use a cemented if I get in there and the bone is just so soft, and it may be one of those where the x-ray appearance, it just looks like it's almost washed out, very osteopenic, and then you confirm that intraoperatively by seeing the very soft trabecular metal. I don't have a hesitation at that point to go to more of a cemented knee. And that tends to be more on the tibial side. I may still use a press fit femoral component, but really the quality of the bone sometimes will deter me, and that's a rare situation. Part of the reasons I really like the Persona trabecular metal is one, trabecular metal's history. The tantalum, the ingrowth that we have seen on our hip implants, the longevity. You know, when we look at how long we've been using TM implants on the tibia back on the next gen days with the monoblock and the modular, we have an incredible track record. And to me, the track record is the most. I don't want loose components. I don't want to tell patients that we have to take them back. And we do have that track record with the trabecular metal implants. That metal with the tantalum seems to really encourage that osteointegration that what we need in press fit total knees. So also within the Persona knee system, we have the standard and we have the narrow. And it's a nice approach because sometimes when you do put these implants in there, it looks like it might be hanging over the bone just a little bit. But with Persona, you can then drop that down without changing the size, and you can get slightly more narrowed components which seem to fit the bone very well. Also on the tibial components, we have anatomic components for rights and lefts, and it really does seem to fit that bone extremely well. The way these have been designed, the way they place on the tibia, the coverage is excellent. And another big reason why I like the Persona tibial base plates. I've pretty much been a PS guy until about 3 years ago when I converted to the medial congruent poly. And some of the reasons I've converted is I heard about the mechanics of it. I went over it with the Zimmer engineers, and it really made a lot of sense. You don't have a necessarily constrained femoral component, but you've got a femoral condyle that stays within a well and allows a little bit of a millimeter translation anteriorly and posteriorly while driving it laterally. And it really does seem to mimic the natural anatomy of our tibia. If you think about it, the medial side of our tibia is a concave and the lateral side is a convex. And this poly is probably the closest to represent that. The other thing is we all see this as a CR user and a PES user. Patients will complain of what we call this little bit of a clunk. Basically, they take the knee and they can rock it a little bit, and we've always told them, oh, that's just the mechanical nature of the knee, which is absolutely true. With the medial congruent poly, I'm seeing so little of that. Those concerns or questions from patients really aren't raised very much. Probably the third reason is the mid-flexion point. Whenever I take a CR or a PS component and you put them at that 40-degree angle or 30-degree angle, you can get it to rock a little bit. With the medial congruent poly, that is less and less. And these are the major reasons I've converted over to a medial congruent poly. With the medial congruent poly, we have the ability to remove kind of that paradoxical translation that we see with the tibia. We see these with CR knees where when the patient gets up, that translation of that tibia occurs until that PCL fires or contracts. You don't get that with the medial congruent poly. That medial femoral condyle stays within the well, and you do not have those issues with that. I do think patients get an earlier rise out of a chair, and I do think they can navigate stairs or low seats much easier with the medial congruent poly because of that medial femoral condyle constraint. I started using Rosa last year, and I am not one to jump on new technology right away. But the more I played with it, the more it made sense. The more I realized that this was different than anything we've ever used before. This is beyond computer navigation. This is beyond personalized cut blocks that we make with MRI and CT scanners. Using Rosa has allowed me to really hone down the balancing of the knee, finding weak points of what we used to have. Maybe mid-flexion instability. Using Rosa helps me correct that. And using the Persona trabecular metal implants and not using a tourniquet, it was a perfect match. It never slowed down my flow. I've become time neutral, and it has absolutely changed the way I can place components within these patients' knees. The balance I achieve at zero, at the mid-flexion, understanding how the knee moves, how it behaves, even after an injury. The Persona mated with the Rosa knee system has been incredible for my patients. So with Rosa, what really separates it from anything we've done in the past, that includes custom cutting guides, that includes computer navigation, is the fact that we're taking the patient's ligaments into consideration. This really does change how we put a knee in. It also changes on how we balance the knee. And I do believe this is going to give us a much better outcome. We are seeing this in the early outcome stages in these patients. The knee intraoperatively is more balanced. We're able to now reproduce grafts, which are phenomenal. Everything in the past has been how it feels to us. And now we can correlate how that feels to us by actually registering a graph of exactly what that knee is doing in our hands intraoperatively. I've always used the press fit knee. And of course, press fit knees are dependent on great cuts. You want these accurate. We don't want any ridges because we do want good osteointegration. If you don't have a smooth and a flat cut, there may be a chance that you could get some loosening because you never really got the components completely flat on the bone cut surface. Using Rosa with press fit knees has been amazing in the sense that when we pin our cutting block, we then not only have the two pins in the bone, but we also have the strength of the robotic arm. So when you're making your cut, you can keep a nice even pressure on that cutting block without worrying about changing the position of the cutting block, which is what could happen when you've pinned in some osteopenic bone. The addition of that robotic arm has really made me look at our accuracy of our cuts, and they've been amazing. There's been no gaps at all on our distal femoral or on our proximal tibial cuts.